Hello and welcome, everybody. Hello and welcome to this PPI event, Voices That Matter, a live conversation with expert advisees, partners in nursing, research and education. My name is Dr. Bridget Murray and I'm going to be the panel moderator today. So let's get started. So, first question. Could each of you give a brief description about your background, what led you to become an advisory partner or patient public involvement PPI champion in nursing, research and education? So we'll start with Sarika.
Okay, hi everyone. I'm going to apologise in advance. My voice is a little bit honky, so I'll try. My name is Sarika. I'm a qualified midwife. I graduated from Midwifery in 2014 from Dundalk IT, but I'm also a person living with MS. I was diagnosed with MS the year that I graduated, so the timing was just absolutely magical. My MS turned out to be quite aggressive, and long story short, I ended up having to retire from midwifery in 2019, and when I retired, I needed to pivot and do something, so I did a course with an organisation called IPOSI, which is the Irish Patient Platform on Science and Industry, and they do a patient education course, so I did that in 2019. The pandemic happened, lots and lots of things happened. I had a lot going on myself. My MS was very aggressive still, rampaging, all that kind of stuff. Had a stem cell transplant 2 years ago, which has stopped it in its tracks, hopefully. And then last year I became a UPATI fellow, which is similar to the IPOSI training, but it's a European-wide recognised certification. I did that last year. In terms of my area of interest, I'm very, very interested in patients being embedded in the training of undergraduate healthcare professionals. So I think it's all very well having people coming in doing postgrads, but I think from year one, I think that there should be patient involvement of some sort when nurses, midwives and doctors and people are training. So that's really my big area of interest now. I'm also a PPI panel member on the RCSI Future Neuro. I participated as a patient advisory planner with the Run Me trial in UCD, which was review of undergraduate nursing and midwifery education. And last week, just as an example, I gave a talk to third-year student midwives in Dundalk IT about looking after people with MS and telling them what MS was because they don't know. And I got lots of positive feedback from that, which I'll go into later. But that's essentially me in a nutshell.
Thank you. We'll go on to Chanel. Thank you very much.
Thank you, Bridget and Sarika. My name is Dr. Chanel Watson. I'm a Senior Lecturer and Deputy Director of Academic Affairs in the School of Nursing and Midwifery. In my role, I suppose I am very involved with programme development, and though we would talk very much about the patient being at the centre of what we did, the reality of that up until a couple of years ago was quite ad hoc, and we would have patients come in to speak to different groups of students, but that was probably as far as it went. So about 18 months ago, I contacted IPOSI, and we were very fortunate to have Sarika join our programme steering group. And I suppose we're at the very beginning stage of PPI within the School of Nursing and Midwifery in a more formalised way.
Hannah.
Hello everyone, my name is Hannah Wilson and I have been a nurse for 10 years and I recently joined the School of Nursing and Midwifery as an academic team member. I'm a lecturer in research, and for me I've always been a really strong advocate of how, patients and caregivers, they know best, what's best for them, what works best for them. So for me, doing research without them, it's sort of like having a puzzle with a missing piece right in the centre. And so that for me has been the real driving force for why when I came into the research realm, I've really wanted to bring patients and caregivers on board to enrich what we're doing.
And Declan. Thank you, Hannah.
Thank you. Thanks, ladies. My name is Declan Naughton. I'm not a nurse, a doctor, anyway, medically trained. I acquired a spinal injury back in 2018, so I am the lived experience in relation to various aspects of living with a spinal cord injury and all of the challenges and tribulations that they bring. Prior to my accident, and don't give out to me for this, I was a bank manager and did continue as a bank manager after my accident, but finished up in that a year ago and haven't looked back. In the last 3 years, I've been working for the National Rehabilitation Hospital. So I'm working there as a spinal education and peer support. And it's probably the most rewarding and personal valuable job I've ever had. I'm also working with Paralympics Ireland in promoting Paralympic sports to children and young adults. And then there are a number of different avenues. I'm working with a local school in relation to promoting living with disabilities, and I'm not on about spinal cord injuries or wheelchair use or anything like that. The broad spectrum there is there in relation to disability, in relation to the lived experience. For the last 2.5 years, I have had 5 grade 4 pressure sores and currently living with one on my lower back. So I'm bringing kind of a lot of experience in relation to that side of things. It is extremely important not only patients understand what is required to improve awareness in that field, but also improve their own knowledge in what's, to prevent them becoming bedridden and the impact that that would have on their lives. So that would be my involvement, and thank you for having me.
Thank you, Declan. And that leads on to our next question very nicely. In your own words, what does patient and public involvement mean, and why do you think it's important in nursing research and education?
We'll just go down this way again.
Yeah.
Okay, so for me then, I think as somebody who went through the system, was trained as a midwife, I have often said that the most impactful class that I ever had in my 4 years of undergraduate training was a woman coming in and talking to us about her experience of having an intrauterine death, or she had a stillborn baby. And that's, I think it's 12 years ago that she had a class. I still remember everything about it. And it was impactful because it was a personal story. And I think from my point of view, public patient involvement, there's a big question mark about the word involvement, because sometimes my experience has been that involvement means we put a patient on this, so we've involved them, but they haven't really, and it's a tick boxing exercise. So for me, involvement is not just about involvement, it's about having patients integrated as opposed to just involving them. Seems like a kind thing to do, to just tick a box. So from my point of view, lived experience is so important in education of healthcare professionals, because textbooks just tell you what MS is, but I can tell you what MS is like to live with. And that's the difference, because there is no disease that's just sitting around in a jar. People are carrying them with them. And that's important to remember.
For me, I suppose it's about collaborating with patients to enhance patient outcomes and patient care through education. And it's important because, as Sarka said, if we embed patient perspectives into what we're doing, we're ensuring that our programs are aligned with real-world needs and that evolve over time.
So for me, the word partnership comes to mind, because it's really about that shared power and equal weighting between these people coming together, researchers, patients, healthcare professionals, and we decide together how to move forward. Because essentially, patients and caregivers, they have the lived experience, so they live in this 24/7, whereas as healthcare professionals and researchers, we walk out of the hospital at the end of our shift and we close down our laptop, whereas patients and caregivers live with this day in and day out. So they bring that realistic lens of the real world, and I truly believe that that brings just so much more relevance and value into what we do.
For me, it's education and the lived experience. And I talk about in relation to my lived experience. I wake up in ICU in the middle of June of 2018. I'm paralysed from the chest down. More tubes coming out of me than there is coming out of any television in the country. And you're looking at a ceiling, and all that comes into your head is WTF. What happens next? Who am I? I knew who Declan Naughton was then, but didn't know who Declan Naughton was going to be. So when I went into the rehab, I spent a full year in hospital. And when I went into the National Rehabilitation Hospital, and I'm seeing a lot more people around me who are living in their world, whether it be a brain injury, whether it be an amputee, whether it be a wheelchair user. And you get talking to these people, and you get talking to your peers, and the way that they go about living their lives, and the little kind of, to use the phrase, life hacks that they have, for kind of almost cheating the wheelchair system. And you want people to see the person and not the chair. Yeah. You want people to talk to you about, oh, they're a nice pair of runners that you have on, or that's a nice dress that you're wearing, and not the chair. And it's educating the family in that respect. And that's what led me towards being a peer support officer in the hospital. That's what led me to being involved in this project as well, because it's so invaluable, but not only educating the person, but their family. So one of the things that we do in the rehab hospital is we run a 13-week education program, and every 13 weeks it recycles and recycles. But there was serious things missing from it in relation to supporting family, sexual well-being, questions that people had on the tip of their tongue but did not know how to go about asking those questions. And that's ultimately why I've become involved. And then we set up a visual library where their families could go and scan QR codes and extract that information as well, because they were too embarrassed to probably ask it. And then it creates conversation. And the best conversations we see in that hospital is when we're all sitting around the dining table. And you could create a podcast off it, but you would have to bleep a lot of it as well.
Okay, thank you very much, Declan. We'll move on to our next question. I suppose we're going to look at the role of PPI in research and education. And I'm going to direct this question to Hannah and Chanel. And how has the School of Nursing and Midwifery incorporated patient and public involvement in its research and education programs? And could you give me some examples? So I'll start with you, Hannah.
Thank you. So for us in the School of Nursing and Midwifery, we have a Skin, Wounds and Trauma Research Centre, and the focus there is about preventing and treating wounds. So we were very fortunate to recently be successful with a funding grant from the European Pressure Ulcer Advisory Panel, and that allowed us to actually start patient and public involvement in the right way. So we had that foundation there to reimburse people for their time, and essentially that project was about preventing pressure sores based on the needs and experiences of patients and caregivers. And essentially what we want to do is actually bring people together with the lived experience, whether that be people that have had a pressure sore, are trying to avoid one, or who are caring for someone with a pressure sore. And essentially we want to be able to make decisions together, and we focus on 4 key things. And the 4 key things are change, start, solutions and improve. So the first one is deciding together what needs to change in order to better avoid pressure sores, where we should actually start with the changes we want to make, what solutions can help make things better, and how we can improve the lives of those affected by pressure sores. And essentially I see this project as a seed that's going to grow into this larger tree in the future. So that's where we are at the moment in our research centre.
Chanel,
in terms of education, we really are at the beginning of this journey with PPI. As I mentioned, some of our programme directors would include patient voices in presentations to students. An example of that would be in the respiratory programme which Bridget runs. She would have patients with cystic fibrosis who come to speak with the students. Circa is a member of our programme steering group, which I suppose is the overarching group that helps guide how programmes are developed and delivered. And in this past year, we had the added joy of having an NMBI site inspection, and again the steering group would have guided us in that, and we have another meeting coming up in November where we'll report on the recommendations and the commendations and the conditions. So Circa will be involved in reviewing those with us. And I suppose that's where we're at, but we do, and I know we'll talk about it in a few minutes, we do have lots of plans. There are challenges though. As a postgraduate school of nursing and midwifery, all of our theoretical teaching is online, and that doesn't suit everybody. And we're also conscious that our students are all working, and trying to find time in the timetable can be quite challenging. And as academics, and I put my hand up here, sometimes we perhaps put more emphasis on the theory side of things, but that's changing. And certainly in my short time that I have been involved, I can see my own mindset changing and recognising the importance of, as both Circa and Declan have said, of having that patient voice and that patient perspective. But it's certainly a journey that we're just beginning on.
Thank you, Chanel, and thank you, Hannah. The next question I'm going to direct towards Declan and Sarah, and it's the value of having an expert advisory partners. As expert advisory partners with personal experience, what unique insight do you feel you bring to research and the education process?
Well, I always say, I'm not MS. I'm not a condition. I'm a person. And I've said it before, that I would always like to hope that MS is the least interesting thing about me. MS is the reason why healthcare professionals are interested in me, but I'm a lot more interesting than that. And it's probably from my midwifery training, but it's person first, condition second or third or fourth. Oftentimes my experience of being in hospital for a long time, and I was in the NIH as well, they're brilliant. But when I was in the acute hospital setting, it was doctors coming and talking to me like I was diseased with a pair of legs and I wasn't a person. And I just, because I have that insight, because I'm not like the normal MS patient, my MS went really haywire, but actually that has given me a lot of experience actually, and has made me more able to kind of speak to what is the right way to do things versus the wrong way to do things. And it is as simple as actually, and I was saying to the student midwives that I was talking to last week, that sometimes it's as simple as taking a few minutes to actually talk to the woman that you're looking after about her MS. What are her challenges with her MS? What does it mean for her? How, as a midwife, can we support her in her pregnancy? And not the entire focus is not about her MS. So it's always person first, because, and I did is because of my midwifery training, that like we were always told people aren't patients. Like I don't like to call myself a patient. I'm a person. I'm a lot of other things, and I just happen to have MS as well. And I know that's why I'm interested in this scenario, but I think it's always person first, and then condition is like secondary to that. So I think, like in terms of like, there has been examples where again, like I was in part of a research project, it was a tick box thing, and I could feel it very, very obviously that it didn't really matter what I thought or what my input was, because they had ticked the box. But this is really good because you're actually incorporating us and you're integrating us patients, I don't like to say that word, because our story, like I always say, nobody knows my MS better than I do, nobody. And I don't know anybody else's MS, but my story is my story. And because my story has been quite complicated, it's actually a good learning tool. So I like to just take from that and use it to kind of, from my point of view, like I say, I'm interested in the education of healthcare professionals. So if people know a little bit more about MS, they're going to find it easier to look after people with MS because they've heard a little bit of a story about, or somebody's story about it. So.
Sorry, Declan.
For me, it's like, I would joke. I used to joke with my wife when she'd asked me to do DIY. I was shocking at DIY. And I'd say, look, I'm paid from the neck up. You know, it doesn't work from the neck down. Now I am paid from the neck up, and it definitely doesn't work from the neck down. If I can use my voice for greater education and supporting people, that's ultimately what it is. And I can relate to what you're saying. When I was in the acute hospital, I was there for 3 months, and at 7 o'clock every morning, because I was in room number 1, they would come in and they'd wake you and go, Declan, how are you today? And will you tell me? You know, and that's when you're in the acute setting. And I literally extracted every piece of information that I could from them. What's that machine doing? Why are you doing that? And what would happen if I turned that off? And what would happen if we turned that on? And one day I did turn the machine off just to get reaction. Do you know what I mean? And, you know, it happened to be my ventilator, but I was still able to breathe. You know, and I just annoyed the hell out of them, but I wanted to educate myself. Mm-hmm. And that's ultimately where I was. I wanted to have a voice, and ultimately then, you know, pass that on to other people, because that is what helped me, having that voice, being able to be heard, not just seen, and then go about and having the value of that. Like when I go into the rehab hospital, like I'll be going straight back there after here. Every day that I go in, I will either have a member of the team come to me, whether it be a physio, whether it be an OT, regardless, and say, can you go in and speak to, you know, Brian in room 1? Can you go in and speak to Mary in room 5? And it could be in relation to any aspect of my injury. Can we see your van? Because I drive my van directly from my wheelchair. Can you talk to me about what it's like to live with a suprapubic catheter? I heard you were in Portugal. What's it like to go through an airport? And if we're partaking all of that knowledge onto people, I'm just helping them in the smallest way, because what we said before is that when you discharge from the NRH, and the NRH is a bubble, and you probably understand that yourself, so that it is a bubble. You live in a bubble. Everything is there for you. And when you go home and you wake up the next day, it is a smack in the face. And the way that I look at my role out there is, if I can soften that smack in any way, shape or form for patients or family, you know what I mean? And that's the way that we go about it. And you know, the word disability, I hate the word disability. I don't regard myself as disabled. I won't classify myself as disabled. I will classify it as I live with a disability. There's so many other things that are disabled in society, such as footpaths and everything else. And we're teaching people in relation to, you know, adapt to it. Don't accept it, just adapt to it. And that's where I got involved.
Thank you, Declan. I suppose the next question, we're looking at the future direction and expansion of PPI, and where do we go from here? So I'm going to direct the question to Chanel and Hannah. what are some of the School of Nursing Midwifery's future goals for PPI, and how do you envisage PPI evolving within nursing research and education?
Well, I suppose in the first instance, we want to increase awareness of the value of authentically engaging with PPI, and as Circa has mentioned, it not just being a tick box exercise, and to widen our engagement. And we're really excited that we have a new programme that we are about to begin developing. It's a joint initiative between staff from Beaumont Hospital, staff from James's Hospital, from Future Neuro here in RCSI, and importantly, Circa. It'll be a PG Cert Dip and Masters in Neurology. We've yet to decide whether it'll be a purely nursing programme. I would like to see it more being interdisciplinary, but it's at the really early stages of that. And I think that's another step in this journey in having our very valued PPI member contributing to the development of the programme, development of modules, development of content, and so on. So it's a big shift. It's been a really kind of, I suppose, opportune time for that. It's exciting.
It is exciting.
Yeah. Because nothing like that exists in the country, actually. For neurology, we have a neuroscience programme, but we don't have one to address the education needs of nurses working in specialist roles around the country in areas like migraine, MS, Parkinson's,
And they're also different.
and they're also different. Yeah.
Hannah?
So for me, I'll come back to the analogy again of the seed. So at the moment, I'm working directly with Declan, and he has been instrumental in partnering with me in the project and getting more people involved in our advisory panel. And essentially in the future, I imagine this to be, we'd have a large PPI panel set up so that it would feed into all the work that we're doing in our Skin, Wounds and Trauma Research Centre. But in the immediate future, we are hoping to set up a panel of about 10 people, and that will really inform the future work that we start to do for preventing pressure sores. And then where I see this really going is presenting the work at conferences together and to local communities as well. So that really involves reframing our language, because at the moment we write research papers for researchers, and I feel like that really needs to change. I know we're starting to develop more of layperson summaries at the beginning of research papers, which is a huge step in the right direction. But I really believe that communication is a central piece of this, and we need to start to simplify our message, because the impact of this work could be far further reaching and have a larger impact if we're able to communicate the results to the general public. And essentially that would be like a vicious cycle that would fuel more patient and public involvement, because there'd be more understanding and interest about what we're actually doing. And I think that would get more people involved in this. So it really is about raising awareness and growing it into that bigger tree.
And I suppose leading on from that question, Hannah, how do we encourage more involvement, and what steps do we need to take to increase diversity and broaden representation on our expert panels, our advisory panels?
Yeah, so that's a really important one, because diversity is so central to our project. And actually that's one of the key reasons why Declan came on board at this early stage of the project. So before we even set up the people, I want to make sure that we focus on our communication strategy. So how are we getting that message across to people, and how do we hit the right people as well? So our key message is really your voice matters, and we want to keep that really front and central. So we've created a graphic, so a picture to bring that message across. We're doing this today, so we hope that our voice message would be clear to people as well as obviously connecting with local charities and feeding into local communities as well. So one thing that's really central to this project about preventing pressure sores is to be able to include people with diverse skin tones, because we want to be able to better understand how to avoid pressure sores and to address healthcare disparities, because at the moment we don't fully understand how to assess pressure sores in a darker skin-toned individual, and therefore preventing them in that population are incredibly important. So this would be enriching our work so much more to bring that diversity piece front and central. So how can people get involved? So We have an opportunity up at the moment on the PPI Ignite Opportunity Notice Board, and the title of our project is Voices That Matter. Join us in our mission to stop pressure sores. So you can go in there, take a look at the opportunity, and you can also contact me directly, Hannah Wilson, at wilsonhannah@rcsi.com. And that could even just be a question about anything, and I'd be more than happy to point you in the right direction or talk about how we can get you involved. We also hope to launch a project website in November. And within that website, we hope to keep the public up to date about our progress with the project, and also allow people different ways to get involved. So that will be a platform that will help the public get more involved as we move forward with this work.
Declan, have you anything else that you'd like to add there?
No, I think Hannah has summed it up perfectly, but it's just the case, just from the diversity side of things and the different, skin tones and skin colours, that's something that I'm even getting educated on by working within the hospital. I didn't know what a TVN was. Somebody said to me, we need to go and see the TVN. What channel is that on? I didn't know what a TVN was, and then I'm being educated in relation to the different types of dressings and whether you're doing Aquacel AG or Aquacel Extra or Manuka honey. I put Manuka honey on my porridge, not on my tones. And again, that works for my skin tone. Do you know what I mean? And the way that blanching operates, and then it's educating families in relation to, well, your skin tone is, slightly darker, or it's a different base to it. So that's ultimately what we're trying to bring more people within the public sector, whether that be family, or friends, whatever, but for them to understand how to actually firstly recognize there is a change in the tone in your skin. Don't ignore it. Yeah. If you see that change, and for me, somebody put it beautifully, for my skin tone is, if it's red, stay in bed. I didn't stay in bed. And then suffer the consequence. So for it's more education in relation to the amount of different nationalities that we have within the hospital would astound you. And it's just to understand that we have a responsibility for further education in that field.
Thank you, Declan. And that leads on into personal reflections and insights. So this is what as far as Sarika and Declan here. This question, how has being an advisory partner impacted you personally, and have you learned from this experience, or what have you learned from this experience?
So on a personal level, obviously having to retire from midwifery, well, I felt like I did it for 10 minutes because I graduated the same year I got diagnosed, and I felt like I had to do something with all of the learning I had done, and it was a vehicle for me to use my brain, because I thought very much when I was in the NRH, and I was there under the brain injury program because I had significant problems with my memory. I couldn't remember. If somebody told me something 5 minutes later, I couldn't remember it. So I had to really work on my memory, and I said, even doing stuff like this, because I have to write notes because I forget. So that was the impact on me. But then it was like, you know what? You could just sit on this and, God, this is terrible. Or you could try to make some sort of difference, because like I say, and I said back to it, the woman who came in and told us her story about having a stillborn baby still lands with me today, because it was the one class that we had. And even when I gave my talk to the students last week, they were so glad that I didn't come in with a PowerPoint presentation, because I think people get so sick of them. And I would never actually go to something like this with PowerPoint, because people tune out. They're not listening. But when they're hearing the personal story, on a personal level. So for me, remind me of the question again, Yazid.
This is what happens. No problem.
Sorry, this is what happens.
Being an advisory partner, how has it impacted you personally, and what have you learned from it? So you're on the right track.
Yeah,
and
I've waffled. Sorry, no. So for me, then I'm involved with RCSI Future Neuro. I'm on the PPI panel there. So I've met lots of other people, lots of other neurological conditions, and I've learned very quickly that we're all completely different. So while we're all under an umbrella, my MS is not the same as somebody's Parkinson's, and they're totally different. And I've learned that neurology in particular is a very, very underserved branch of medicine. There are not enough neurologists, there are not enough MS nurses. Trying to get access to treatments is just absolutely nightmarish. So I think from doing all of this training that I've done, that I feel like I'm more confident to be an advocate and an agitator maybe, which is probably not the right word, but sometimes we have to. sometimes as patients you can't just sit and accept the status quo. Like, I'm agitating all of the time now for stem cell transplantation to be done in Ireland because I had to go to the UK to get it done. It's already done here, just not for people people like me, because it's only MS, and that's what I was told. You only have MS. My MS rendered my life. It turned it upside down, but I had to go to the UK because I wasn't sick enough to get a stem cell transplant. So that's one of my areas that I'm kind of agitating for, but I feel like I get personal peace from doing something, because otherwise it's like, what am I going to do? Just sit around looking at, like I was saying earlier, just watching Tipping Point all the time and going, is this my life now? Is this it? And like I was saying to the others, my daughter's now gone off to university, and her whole life really that she can remember, Mammy's in and out of hospital. And I would just like to make MS for anybody else easier. And sometimes that means that the nurses that are looking after you know a little bit about MS, or the midwives or whoever, that you're not just going in cold and they haven't a clue. So that's, I get personal satisfaction from that. So that's my takeaway.
And Declan, how has being an advisory partner impacted you on a personal aspect?
In one, like, I've always been self-driven, but in another way, it's driven me to understand and learn more.
Okay.
You know, I didn't know what I knew what a spinal cord injury was before my accident, but I did not know what a spinal cord injury was before my accident, and the layers and layers and layers that are involved in it. And then when I'm working in the hospital, and all of a sudden somebody is telling me that they're in with GBS. What's GBS? And then, I'm going and researching, Guillain-Barré, and then you hear of other diagnoses. It forced me to educate myself, and it forced me to understand other people's diagnoses and other people's worlds. You know what I mean? I get bored telling my own story, but then you have to remember it's that person's first time to hear it.
Yeah. And it has huge value.
Yeah.
Yeah.
You know what I mean? I have a colostomy bag by choice because it's easy with my life. And the amount of times that I go into the hospital and say, can you go in and speak to so-and-so about, life with a colostomy? And they're just like, oh, Declan's known for his van and the colostomy bag, but hey, we'll keep going. You know what I mean? And I'd say that in jest, but that's what I love. If that gives that person some education.
Yeah.
If I've educated myself around GBS, if I've educated myself in relation to various aspects of spinal tumours, playing wheelchair rugby with a 12-year-old girl who's lost both her arms from below the elbow and both her legs from below the knees, and having the laugh and the crack. I mean, if that's what I can give back in relation to it, I would take that any day of the week, because you do go away from the hospital feeling a little bit lighter. You can take home the emotional baggage because you hear of the challenges that people are facing. But that's the experience that it has given me, and that's the experience that I hope I'm giving back as well.
Thank you very much, Declan. And coming to our final question, I open up this to everybody here. What would you say to patients or members of the public considering becoming involved in advisory panels or PPI initiatives? And I might start with you, Hannah, if you don't mind.
Yeah, I would start by acknowledging the fact that I understand it can be very daunting to get involved with people that you don't know. But I will say that our team have a real passion for this, and we want to create trust, we want to build relationships, and we want to make this a really meaningful experience so that you walk away feeling like your voice has been heard and that your inputs have been valued. So we really, as I say, have a passion for partnering with patients and caregivers, and I truly believe that it's only together that true breakthroughs in our knowledge and healthcare improvements can happen.
Thank you, Anna. Sorry, Kat.
Yeah, so I think for people who would question, should they do it? I should absolutely do it. Now, it's not all plain sailing, like you do run into frustrations and roadblocks sometimes, because I think the nature of it is that when you're in a group of advisory panel, people are not necessarily coming from the exact same point of view as you are, so you learn how to kind of collaborate, and your voice is just as important as somebody else's. So, well, somebody in a group that I'm with maybe has something in my head that I go, oh, their condition is worse than mine. It's not, it's just different. And we all have our own perspectives, and you learn how taking all those perspectives into consideration actually makes you a better kind of advisor, because you can kind of see a broader picture from being involved in these panels, and you meet so many people, that it's just really enriched my experience anyway, I have to say.
Thank you. Chanel?
I think listening to how passionately both Sorcha and Declan have talked about their experience, that is a huge incentive for people to take part. From an education perspective, being involved is an opportunity to not only shape the healthcare in the future, but to shape the education of the people who will be delivering that healthcare in the future. And I think that has come out of today's conversation, both the care itself, but how it's delivered as well, and having practitioners who are knowledgeable and recognise the differences in people's experience and can use that to improve the care that they give.
Yeah, because it's person-centred instead of disease-centred. You're looking after people.
And Declan, is there anything that you'd like to add there?
Yeah, like for the past, I don't know, 30, 40 minutes, you've been listening to our voices. Give us a chance to hear yours. That's what I'd say.
Good, yeah.
Just give us a chance to hear your voice, because I can guarantee you're going to bring as much experience or knowledge, or probably more, than what we have as well. So just give us a chance to hear yours.
Thank you. Thank you all very much. I'm going to encourage the audience maybe to ask some questions based on the discussion and the interest in this topic. So if anybody has a question, please direct it to...
Thanks very much to the panel. It was such an interesting discussion. I'm just wondering, around research design, what's the progress so far with patient and public involvement?
So in SWOT Centre or in general?
Yeah.
So whenever we do look at the literature around patient and public involvement, it can be embedded in any stage of the research cycle, but it has so much more value whenever it's brought into the beginning. So when you're developing a research question and you're identifying where the priorities are, so that's the stage that we are at. So we felt like it's so valuable to start there, because they have a greater influence to shape the direction of where the research will go. But at the same time, I wouldn't want to put anyone off that's maybe already into the research process and they're maybe disseminating the findings, which is one of the final stages. And that's where the communication piece can be really vital, because it helps, Declan, for example, has helped me simplify terminology so that, it makes it easier for people to understand. And this comes back to the piece around, we need the public to understand our research findings in order for them to get on board and maybe be interested in being involved in projects. So I would say it comes into every stage of the research process, but I really want to highlight the benefits it truly can bring from the beginning, and developing that relationship throughout the process as well.
So I'm just wondering then, on research protocols, are they included as like a research partner?
Yes.
Okay.
So because it's a partnership, so it's good to clarify that, because a lot of the time now we see in research papers, there's a section now specifically for patient and public contribution to the work. And I think sometimes researchers can maybe get a little bit confused and think that because the patients have been part of the study that they can write that in that section, whereas this is not patients taking part in a study. They haven't consented. We're not collecting their information. They are partnering with us and making decisions on how the research will be conducted, the design of the research, every single aspect of how, the planning and conduction and the dissemination will go. So they should be partners. They should be listed on the research protocols, on the publications, and essentially presentations as well. So, yeah.
Great.
Is there any other questions from the audience?
Sorry, hi. I actually was really interested when he said, like, I want to have a voice. And I was wondering, or you, Declan or Sorcha, like, how you think being like a person that, as you said, I am a person, I'm not my disease, but like, how could you bring more people to engage in this kind of, to go to help with this research and help the healthcare professionals to, to develop the way that you want, like you want to be heard. You said, I had to understand what's going on with me in every step. And now that I have this education and passing through with the kids and everything that you have been doing nowadays, but like, how do you bring this to the population, like to people that could be more engaged? What do you think?
Well, we start off in the hospital with our education program, as I said, we run the 13-week program. While that is for the patients while they're there, they're also given a binder with the books that are direct to the talks that we're doing. And on that, there is the QR code then for the family to actually have access to all of that information. And, we would openly discuss that. So when they first arrive in the hospital, like within the first couple of days, they're given the book, and either myself or Kira, my colleague, would give them the book and have a chat with them and just kind of start planting those seeds in relation to don't be afraid to ask questions. Ask whatever question comes to mind and ask it repeatedly. And in time then, over the time that they're there, you'd have a patient that could be there 8, 12, 16, 24. It depends on the level of their injury and the need of their stay. I have had patients that have been in that hospital for 2 years, and they went to every education talk 4 times over just to increase their knowledge. And then that is creating in itself, it is creating discussion around the hospital, it is creating discussion amongst their peers. That's ultimately where we start. And where it all started for me, because you mentioned children, I have 2 kids, and they're now 18 and 13. At the time when I was paralysed, they were 11 and 6. And you're then kind of going, how do you tell an 11-year-old and a 6-year-old, Dad's not going to walk again? And the best way that it was put to me by any of the consultants was, don't lie to them. Because if you lie to them now, in relation to any aspect of, use the word journey, don't like it, they will never believe you again. But you make it age appropriate, you know what I mean? Or you make it content appropriate. And that's ultimately, and after about 6 months, my 12-year-old then came to the realization, you're not going to walk again, are you? And I said, it's not likely, but we'll continue working with the doctors. Same way then when we introduced talks in relation to supporting family, when we introduced, there is a taboo subject in relation to talking about sexual well-being in Ireland. God forbid you could talk about that. But again, we started introducing these talks, and you might have 1 patient or 2 people coming up. Now we've got 16 and 17 coming up, because it's how it impacts the life, and that's where we started. I hope that answers your question.
Thank you very much. Is there any other? Oh, there's 2 questions, one there and one here.
Hi, thanks so much for that talk. It was brilliant. I guess for Sarika or Declan, just wanted to check. You both said about, or you mentioned how much you gain from telling your story and kind of giving back in that way. I'm sure there's days where maybe you don't feel so like sharing your own personal stories. And I wonder, just as an institution, either in education or research, what supports you think there need to be for yourselves or for others that are sharing their story over and over again, where it might be, it might be bringing up past experiences that are difficult for them.
I think I said this before, actually, possibly to you, Niamh, but so it's great to have patients involved, but at the same time, don't have the very small pool of 2 or 3 people. Have more people, involve more people, because I always say I'm sick of talking about MS. I'm sick of it, because MS should be just, especially now that my MS is in hibernation, and it's not kicking my ass all the time now, and it's a little just unwelcome squatter in my life, but it's not who I am, and I know that that's important, but you have to just kind of contextualize. There are parts of my story, I think I've said it, really traumatizing, not knowing who my daughter was. My sister had to come into hospital to consent to me having brain surgery because I didn't know where I was. And I think I've said this to you before about the frustration of not being able to remember anything. Not being able to remember a bank card PIN number for weeks. For weeks and weeks, I've just been so irritated with myself. And obviously I'm living with it. It's a mild brain injury I have. You saw a little evidence of it there that I trailed off and I forgot what I was saying. But you have to bear in mind that if you have lived experienced people on board, my voice is going to disappear. That, I have a mild brain injury, so I can't do absolutely everything. And I would say, instead of just relying on one person all the time, that's going to be debilitating on anybody. To just have a pool of people to dip in and out from, because it's a lot for 1 or 2 people to carry that can on their own. I don't know, does Declan agree?
No, I would agree with you. You need your support around you. Even in relation to, yes, me telling my story, for, I don't know, the hundredth of time, I was asked to present to a TY class that we bring TY students into the hospital twice a year and just present, my story. But I twisted it this time around and I said, tell me what you want to get out of here. I know what I get out of it, but tell me what you want to get out of it. Is there a specific field that you're interested in? Is it physiotherapy? Is it radiography? And I'm back with them tomorrow and say, okay, sum up your experience in one word. You know what I mean? I have a men's day coming up in November the 16th, where I'm actually organising it for the men in the hospital. We do get our one day a year, that and Father's Day. But they said, Declan, will you present at it? No. Why? The men in here know me. They don't want to hear about me. They talk to me around a cup of coffee. Yeah. So I reached out to get somebody else in. So Barry, will you present at it? Don't know Barry from the man in the mill, but it would be interesting in, from that. And that then gives them access to somebody else.
Okay,
and then we bring up somebody else in. Yeah. And we did a family there where we get different, you have to vary the level of people that you're bringing in. And, it's Men's Day. Okay, we're going to bring Kira in to speak to them. It's not about gender. It's about experience. Yeah. So you have to be diverse in that way as well, because Kira brings a whole different story in relation to her journey. So it's broadening that spectrum to them. And that's one of the reasons why as well I went back into the schools to kind of create awareness amongst young people. If we can create awareness amongst young people, please God, in 10 and 20 years, for people who are unfortunately living with some level of, disability or impairment, society might be that bit more richer and more experienced for them as well. So that's kind of where it comes.
Thank you both. Thank you, Neil, for that insightful question. I think we have another question from the audience here.
Supportive and coming around to RCSI, and I do appreciate you. Actually, my question is some of them have been answered, is close to what the question she asked, but I'm throwing this to you, Hannah, because you have a research in relating to patient involvement at the moment, and I wanted to ask how or what are your plans in recruiting participants, especially patients, to get involved in this? Because it has been sort of answered in relation to using the same set of people over and over again, but it's a two-way thing. Patients themselves need to know that this is happening, and everybody wants their voice being heard out there. So they need to get involved coming from them, and you as an educator as well, meeting them then. So I'm just wondering, have you plan in place in relation to recruiting and getting the word out there more?
Yeah, so that is a lot of the work that myself and Declan have partnered on at the moment to get the word out there to communities, not just relying on people seeing our opportunity on the PPI Ignite Network Opportunity Notice Board. So that's why it's so important that we have partnered with different charities. We're also very open to going out into communities and speaking with people, because I don't want patients and caregivers to feel like they have to come to me. I'm more than happy to come to them, even in terms of the plans and the decisions that we make. If you're unable to join us for an online meeting or meet here in the college, I'm more than happy to come out to you if it means getting your voice heard, and that's so important to us. So that's why Declan and I at the moment have been working really hard on this communication strategy so that people hear about this opportunity, and I hope that people will hear more about it. We hope to share this recording. We have a beautiful graphic that we've created about the project, and we hope that different charities will be sharing our message as well. So you're right in saying this is really important to get the word out there. So we're doing our best, and partnering with Declan has been a key piece of getting the word out there to real local communities and meeting the people where they are. So I hope that answers Declan.
I didn't hear about it directly through RCSI. I actually heard about it through the RCSI reaching out to the National Rehabilitation Hospital. And I made contact then with Hannah in that respect. So, that's where the first kind of reach out came, and said, and Hannah explained then where we'll go next.
Is there any other questions from the audience before we conclude? No. So I'd like to thank the panel with Sarika, Chanel, Hannah, Declan. Thank you very much for your participation today. And thank you to the audience for joining us here today. I hope you enjoyed this session and many more to come, I hope. Thank you all.
Thank you.
Take care.
Thank you so much, everyone. We're just going to pass around a little feedback form, if you wouldn't mind just filling out how you found the event today. We really appreciate you being here and for the great engagement among all the audience members. And thank you.
That was good.